This is Dr. Saad in front of you, and today my topic is the dengue. First of all, what is dengue? Dengue basically dengue virus. It is a viral infection. Dengue fever is basically a viral infection. It belongs to the family flavivirus. Dengue belongs to the family flavivirus. This dengue virus, you all know that the vector for this dengue virus is the Aedes aegypti. This is the mosquito. Aedes aegypti mosquito. This is the vector for the dengue virus. Now, the dengue virus basically having 4 serotypes. Dengue virus is having 4 serotypes, and the incubation period of the dengue virus is for about 2 to 7 days. The incubation period for about 2 to 7 days. So this is basically the brief introduction for the dengue virus. Dengue virus is belonging to the family the flavivirus. It is carried by the vector mosquito called as the Aedes aegypti mosquito. There are basically 4 serotypes of the dengue virus, and the incubation period is for about 2 to 7 days. Now we are moving on towards the clinical features, that how the patient basically presents to you with the dengue fever. So this is the incubation period. After this period, there will be a prodromal phase. Prodromal phase. And in this phase, the patient will be complaining of headache and myalgias. Clear? So this is the prodromal phase, which is for about 2 days, in which patient will be complaining the headache and myalgia. Clear? Now, after this phase, there is acute phase. Here the patient will be presenting with the full blown features of the dengue fever. Now, the patient will be having fever. What type of fever will be there? Just wait a second, I will be discussing this further. Patient will be having obviously headache. Patient will be having myalgias. Pain, there will be headache. In headache, you can say there is retroorbital pain. Headache also, and also retroorbital pain means the pain on movement of the eyes. Patient is complaining basically that whenever I move my eyes, I am having pain in the you can say retroorbital pain. So this is also one of the features of the dengue fever: headache, myalgias, retroorbital pain, arthralgias means pain in the joints. So these are the basic features of the dengue virus in the acute phase. After that, patient can also means on the examination and on the clinical findings, we can have relative bradycardia, we can also have even lymphadenopathy, other myalgias, arthralgias. So these are the features of the clinical feature of the dengue virus. Now, what type of the fever is there? Fever in the dengue virus is basically continuous fever for about 5 to 7 days. Clear? Fever will be continuous, acute onset, high grade fever for about 5 to 7 days. And there is also a type of fever called as the saddleback fever. We have a fever type called as the saddleback fever. This is basically the biphasic pattern of the fever, means the sudden rise in the fever and after that fall. So you can say this is the not very specific for dengue. It can also occur in other viral infection like the chikungunya. In dengue as well it is there, this type of fever, but in chikungunya can also be there, and other viral infections. So in this, the patient will be complaining that there is a high grade fever, then after that fever drops, and after then again the patient will be having a high grade fever. So you can say drop in the fever after every 4th or 5th day. This is called as the saddleback fever, means high grade, then drop, then once again high grade. So this is basically the saddleback fever, that is a specific, you can say, for the dengue and other viral infections also. Then after a fever, we also patient can be having rash. Now what type of rash? Rash is basically maculopapular rash. maculopapular rash, that is very similar to the, you can say, measles. This type of the rash, it basically spreads centrifugally, means from the center to the periphery of the body, from the center to the periphery of the body. So sparing these palms and the soles, from center to the periphery of the body, maculopapular rash. Then we have the, it is also, then we have morbilliform rash, maculopapular morbilliform rash that blinks on pressure. Clear? So this is the type of the rash which is present in the dengue fever. So the features of the dengue are fever, headache, myalgia, arthralgia, retroorbital pain, rash, maculopapular rash. Now after that, basically we have phases of the dengue fever. What are the phases of dengue fever? I am writing it here. There are basically 3 phases of the dengue fever. Phases of dengue fever. First of all, we have the febrile phase. Febrile phase for about 7 days, in which the fever spikes are there and the patient will be complaining of the fever and other these features. Then the second phase is called as the critical phase. This is called as critical phase. Why? Because in this phase the patient can transform into the dengue hemorrhagic fever or dengue shock syndrome. So these both are the life threatening and the very critical conditions. That's why this phase is called as a critical phase, because in this the patient can be having dengue hemorrhagic fever or dengue shock syndrome. Just wait a while, I will be discussing this dengue hemorrhagic fever and dengue shock syndrome in detail. Then the third phase is the recovery phase. We have the recovery phase. This phase lasts for about up to fever, febrile phase 5 to 7 days. Then we have 4 to 5 days critical phase, in which you have to monitor the patient, and recovery phase for about 6 to 9 days. We have the recovery phase in which the patient starts to recover, the thrombocytopenia resolves, the patient condition starts to improve. So these are the basically 3 phases of the dengue fever. Now we will be discussing the dengue hemorrhagic fever and dengue shock syndrome. Now what is dengue hemorrhagic fever? Dengue hemorrhagic fever is the severe, you can say, form of the dengue fever. Dengue hemorrhagic fever. Dengue hemorrhagic fever. Dengue hemorrhagic fever. So this is the very severe form of the dengue fever, which is characterized by patient will be having thrombocytopenia, and due to obviously this thrombocytopenia, patient will be having bleeding, or you can say very similar hemorrhage. Patient will be having the effusion ascites, can have ALT, AST deranged, hepatomegaly. So these are basically the features of the dengue hemorrhagic fever, in which the patient will be having thrombocytopenia, bleeding, effusion. Ascites means now the patient is getting complicated. This dengue fever is getting complicated. Clear? So this is the dengue hemorrhagic fever. Now patient can move in, move towards the DIC also in the dengue hemorrhagic fever. So you have to monitor all these things. Then the second thing we have is the dengue shock syndrome. Dengue shock syndrome. What is dengue shock syndrome, and what is the difference between the dengue hemorrhagic fever and the dengue shock syndrome? Basically all the features of the dengue hemorrhagic fever along with dengue hemorrhagic fever plus hypotension, means the patient condition having shock. Dengue hemorrhagic fever features along with hypotension, bradycardia, restless, irritable. This is basically the dengue shock syndrome, in which the patient is moving now towards the shock. So Dengue hemorrhagic fever, thrombocytopenia, bleeding, effusion, ascites, involving other features, involving kidney, involving liver, involving you can say lungs. So this is the dengue hemorrhagic fever. Along with this dengue hemorrhagic fever, if the signs of the shock are present, it means hypotension, bradycardia, restless, irritable patient, means getting worse, GCS is decreasing, it means now the patient is moving towards the dengue shock syndrome. Now, on the basis of the lab investigation, how you will differentiate the dengue shock syndrome and the dengue hemorrhagic fever, this is very important point, that on the basis of the lab investigation, how you will differentiate these two. So, in CBC, if the hematocrit, if this hematocrit, if it is increased, it means that this is dengue shock syndrome. Increased hematocrit with obviously thrombocytopenia. Clear? In the dengue hemorrhagic fever, the hematocrit will be decreased, obviously along with thrombocytopenia. So this is the very differential point on the basis of the CBC, that complete blood picture, that the hematocrit will be increased in the dengue shock syndrome, and in dengue hemorrhagic fever the hematocrit will be decreased, while both will be having thrombocytopenia. So this is the differentiating point between the dengue shock syndrome and the dengue hemorrhagic fever. Now after that, what are basically the warning signs, that what are the signs that will be means making you cautious now that the patient is getting worse. So what are those signs? Very important warning signs that you have to monitor. The dengue is all about monitoring. The dengue can lead to severe condition also, and it can also, patient can heal very easily also. So you have to monitor the patient very importantly. So warning signs, what are the warning signs? There are 5 to 6 warning signs. First of all, we have abdominal pain or tenderness. Then the second one, we have the patient may be having persistent vomiting. Means if the patient is having abdominal pain or tenderness, it means there is something going on, some problem is going on. Either it is hepatomegaly, it is ascites, it is pleural effusion. So you have to rule out. If there is persistent vomiting, once again there is some issue. Either the patient can also develop pancreatitis also, the dengue patient, in rare conditions. So you have to monitor this persistent vomiting. Then we have effusion, ascites, these two things. Then hepatomegaly greater than 2 centimeter. Then we have the mucosal bleeding, very important, because thrombocytopenia can lead to the bleeding, and if the patient is bleeding, this is also a warning sign. Then last we have increased hematocrit with decreased platelets, that I told you here, that increased hematocrit with decreased platelet is a sign of dengue shock syndrome. Then you have to be very cautious in this condition. So this is all about monitoring, that you are managing the patient of dengue. So you have to see these warning signs, that if these are present, you have to involve the ICU department also, you have to involve other departments also. So this is now the patient is getting complicated if these warning signs they are present. Clear? So we have discussed the introduction of the dengue, we have discussed the clinical features, then we discuss about the dengue hemorrhagic fever, dengue shock syndrome. These are the warning signs. Now we are moving on towards, okay, before moving on, there is a test that is called as the tourniquet test, that is done in the patients with not done right, it is not in the practice, but you must know that what is tourniquet test. Tourniquet test, this is basically that you have to inflate the BP cuff in between systolic and diastolic BP, between systolic and diastolic. Systolic is 120 and diastolic is 80. Now in between these two you have to inflate the cuff, leave it for 5 minutes and see the patients. If the patient is developing petechiae on the hand, then it means that this is a sign of thrombocytopenia, this is the sign of capillary fragility. So this you have to see, this is the test you have to know, just because this is not ethically very good for the patient, it is also comfortable for the uncomfortable for the patient. That's why we are not going to carry out this tourniquet test, but this you must know about this tourniquet test. Now this is the dengue hemorrhagic fever, dengue shock syndrome. Now what are the investigations? Obviously in the dengue, if the liver is also involved, so hypoalbuminemia will also be there, AST and ALT will also be raised. Now what are the investigations? Investigations that you are going to carry out in the dengue. First of all, you all know we will carry out CBC. In CBC you will be seeing leukopenia, thrombocytopenia, obviously hematocrit and hemoglobin. These all things you have to see in the patient in the CBC. Then very specific test for the dengue is dengue NS1 antigen. But important thing to know that this dengue NS1 antigen, this must be carried out in the febrile phase, means in the 7 days in which the patient has developed the fever. So in that phase this is very reliable, the dengue NS1 antigen. After that, that can be falsely negative. So after that you can carry out the serology of the patient, IgM and IgG of the dengue. Then you can also carry out the viral PCR RNA, dengue virus RNA PCR. You can also, but the common practice is the NS1 antigen in the febrile phase, and the serological evidence is the IgM and IgG serology. So these are basically the main investigations that you are going to carry out in the dengue fever, in the patients of dengue. Now after that, treatment is very simple, just monitoring is very important. So treatment is very simple, but monitoring is very important. Treatment is oral and IV fluids. Mainstay of the treatment of the dengue fever is the fluids. You have to prescribe, you have to give the oral fluid. If the patient is having vomiting, then you have to give IV fluids. If due to some reason the oral cannot be taken, then you will be giving the IV fluids to the patient. So this is the mainstay of it. There is no any antiviral treatment for the dengue, there is no any use of steroids, nothing. Just you have to give the fluids, and you have to monitor the patient. Monitor for what? I told you the warning signs. These are the warning signs, you have to monitor them. You have to monitor for the bleeding, because the patient of the dengue will be having thrombocytopenia and they will have the increased tendency to bleed. So that's why you have to monitor the patient. If the platelet count is less than 10,000, then you can transfuse platelets to the patient. If it is between 10,000 to 30,000 and the patient is bleeding actively, then you can also give platelets to the patient. Otherwise there is no any such indication of giving or transfusing platelets until the patient is bleeding. And you have to obviously monitor the patient with the, if he is going in DIC. If the patient is going in DIC sepsis, then you have to treat it accordingly. In DIC you will be giving the cryoprecipitates, you will be giving the fresh frozen plasmas. So this is the treatment for DIC. While platelets, if the patient is bleeding, so you will be giving the platelets, and platelet count if less than 10,000 you will be giving the platelets, transfusing the platelets. Now last thing that is remaining is the complication of the dengue virus. So dengue is very important, and it can cause a very, you can say, bad complications, severe complications. So what are the complications? We have meningitis, we have seizures. Obviously in dengue you will be having electrolyte imbalances and all those features that will be predisposing the conditions. Meningitis, seizures, we have cardiomyopathy, arrhythmias. Patients of dengue can lead to AKI, can lead to ARDS. Obviously effusion, pleural effusion and ascites, this is also a complication of dengue. Patient can go into the DIC, rhabdomyolysis. So these are all the complications of dengue fever. Meningitis, seizures, cardiomyopathy, arrhythmias, AKI, ARDS, pleural effusion, ascites, DIC, rhabdomyolysis, these are all the complications that you have to monitor the patient. That's why monitoring is, I told you that's why the monitoring is very important. I'm already telling you that oral fluids, IV fluids is you are going to give platelets, but the monitoring is very important. You have to monitor CBC daily, you have to monitor these warning signs, you have to monitor all the complications. So this is very important. So in the dengue we studied about the introduction, we studied the clinical features. In clinical features I told you, the important thing is also very that in clinical features the patient will be having severe body pain, whole pain in the body. So patient will be complaining very severe body pain. Arthralgia and myalgia will also be there, but severe whole body pain will be there. Retroorbital pain will also be there. So that is also called as the breakbone fever. So that is called as the breakbone fever. Severe body pain. Clear? And in clinical features, patient can also develop lymphadenopathy, patient can develop relative bradycardia. What is relative bradycardia? Basically at every 1 degree rise in temperature, there is 10 increase in the pulse. Every 1 degree rise in the temperature having 10 increase in the pulse. If there is on 1 degree, if there is less than 10 rise in the pulse, then it is called as the relative bradycardia. It is also present in the typhoid, it is also present in the dengue, in the viral infections. Clear? So these are the clinical features we studied. Then we studied the phases, the febrile phase, the you can say critical phase, then the recovery phase. Then I told you about the rash of the in the rash, maculopapular rash in the dengue. Then we studied about the dengue hemorrhagic fever and dengue shock syndrome, the differences between these two. And after that I told you about the you can say the investigation, CBC, NS1 antigen, PCR, serological evidences. These are the tests that we are going to carry down the dengue. And then the treatment of the dengue, main treatment is the oral and the IV fluids, and the complications that are important to monitor. So if you have any query, any confusion, you can ask in the comment section. Thank you so much.